Okay, everybody, you are here because you've currently got runner's knee or you've had it before. You know how frustrating it can be and you want it to go away once and for all for good, and you want it to never ever come back again. And these are the key strategies that matter to achieving that. So the first one you're going to notice is the same as the first in my previous video, managing your training load. And that is because it is the absolute key. So if you currently have runner's knee or you get these little bit of recurrent niggles, don't train through any pain that is more than a 3 out of 10. A little bit of a niggle here or there is fine, but if it gets more than a 3 out of 10, please stop. Know that pain in this doesn't equal damage. So yes, running through that little bit of discomfort is fine, but you can't trudge through that. When it comes to returning to running after you've had runner's knee or once it's finally settling, make sure you increase distance before intensity first. This is a really nice way to make sure that your return to running stays really nice and smoothly. Your other big key here is making sure that when you're increasing your long run distance, so let's say you've done 10K the week before, you don't want to increase that by more than 10% the following week. So that means your next one should be 11 kilometers. Okay, so you really want to make sure that you're only increasing that long run by 10%. That is the key, because fatigue happens if we excessively increase that long run and our bodies aren't ready for it yet. Another really good training load management tip is using a lever. Okay, so body weight support treadmill training. So when returning to running or progressing your running loads, even when you're at full level of activity, so once your runner's knee is settled, I would still recommend using this to look after your runner's knee. So there is actually research that shows that using a body weight support treadmill system can actually reduce your knee joint stresses compared to normal running. And that is exactly what we want, okay? We want to decrease those loads whilst creating the same movements and improving our fitness. So this can allow, like I said, either a safer reintroduction to running, or if your knee is already at full capacity and full impact, it can help you train more whilst reducing that risk of that runner's knee coming back. So I would definitely use this, and I am going to give you a practical guide on how to implement the lever for your running. My next tip is making sure that you have a good strength and rehab program. Yes, you're noticing a trend of this coming up again, but that really is because this is a total non-negotiable. You got to get your training load right. And if you want to increase your training so you can get fitter and run faster, you need to make sure you increase your capacity to match that, especially around your quadriceps, okay? So around your knee and your hip, that is key. Combined hip, combined knee. That is, of course, going to be specific to you, but research does show combined hip and knee program is generally the best. This is going to be long-term you, okay? So strength training is not really anything we graduate from, but we need to progress it. So aiming for that strength session twice a week, it doesn't have to be complex. It can be 3 or 4 exercises that suit you, work on those quads and those hips, and that can be enough to really help keep your runner's knee at bay. There are some progressive knee exercises. You can freeze frame here and have a look at these exercises. But for example, your knee ones can be starting off with your isometric knee wall sits, then doing some isolated quad work and leg extension work, and then doing more compound movements that will translate over to running beautifully, such as squats and split squats. When we're talking about that hip strengthening, again, some good progressive ones can be your hip bridge with some external rotation into the band, doing some fire hydrants. I call them dog wheeze for obvious reasons, but they are really helpful for targeting through that glute max, and then progressing those to some more challenging and a little bit more running specific movements, such as a standing banded clamshell, is really helpful as well. Another area we can touch on is mobility, if it's applicable to you. This may not be, because you may have ample mobility there. In that case, you can flick past this bit. But if you are lacking hip extension or ankle dorsiflexion, so extension and the push off through those hips, opening those up, or dorsiflexion's bringing the toes up, you're probably going to want to address that, because those two things can contribute to increased load on the knee. So doing some dynamic movements can really help with this. Personally, I love hip mobilizations with a band. So I put a thick band over my hip, come into a kneeling position, really open up through my hip, and I find that really, really helps. And doing some really good calf stretches and dynamic movements through there, plus your good progressive strength training, which we know can help improve mobility, is a really good key to helping manage that too. Again, your gait retraining, which I have touched on as well, if it's applicable to you, can really help. So I'm really going to drill home increasing your cadence if applicable. So if your cadence is already quite high, you might not need to do that. But good quality research does show that an increase in cadence of anywhere between 5 to 10% can really decrease loads through the knee. So I would definitely consider that. There are also some specific movements that can increase the risk of runner's knee, such as a decrease what we call a knee window. So that would be if I had you on the treadmill, I was looking at you from behind, and if your knees were to collapse into the midline, so I wouldn't be able to see a window between your knees, that can put you at risk or a higher risk of that runner's knee, or can cause it to come back again. So to address that, you can do those hip exercises I was talking to you about. They are what I call off the treadmill or off running way to address it. But there's also a couple of little cues that you can use in that gait retraining when you're running that could help as well. And these can include like I said, increasing cadence might help that a little bit, but the biggest cue that I like to give is imagine you have a white line down the middle of your legs and you're trying to run on either side of the white line. So that way you're not going into what I call like a tightrope crossover movement. This is best used with a mirror in front of you, or you could film it and have a little look because you don't want to be running looking down the whole time. So some video feedback in a mirror can be really helpful, and also practicing doing these on the lever can be really helpful because it can change where your loads go through your body. So having a lever take a little bit of that body weight there can help that load distribution. Other things that you might want to consider include making sure, if you get these symptoms on a bike, making sure you have a good bike setup. So just making sure your saddle isn't too far forward or too low, because those two things can increase loads on the knees. You might want to consider a lower drop footwear. Again, it will decrease those loads, but whether this translates over to a tangible decreased risk of runner's knee, we're not too sure, but it may be really helpful for you. And making sure you're really sticking to your strength training and understanding your injury and the process. Now, I want to take you through a couple of my tips on how to use the lever, which I think is such a good thing for helping manage and prevent this injury from coming back. So first of all, I would definitely use it earlier in your training. This will hopefully help you get back to your running a little bit faster. No, not running faster, but get back to running faster. And it will help you maintain your fitness and help you doing the same movements as well. So that's why I really like the lever over, say, for example, aqua jogging. Build your volume first. So use this to build up to about a 30-minute continuous run. Then you can start to consider adding intervals. And if you are going to include intervals, I would definitely do those using the lever as well. So then you're getting that cardiovascular fitness there, the same movements because you're on the lever with less impact. So it sort of enables you to get that little bump in that fitness with less risk and less load through your body. I would also, if your treadmill allows it, do your first bit of heels work if you were going to consider that with the lever as well, so you can decrease a little bit of that load too. Of course, with this, you want to make sure you're maintaining your natural cadence or even increasing it if it's applicable to you. And like I said, I would definitely use it when you're practicing any form of gait retraining as well, just to help you get used to where those loads are going to go without making other muscle groups sore. Because remember, when we change something, that load has to go somewhere else. So you don't want to end up overloading anywhere else. And that's where your lever will help, because it removes a bit of that overall load. Definitely you definitely need to make sure that you still monitor your pain though. It doesn't give you a free ticket. You still have to use my 3 out of 10 pain scale there. Make sure you're not pushing past that. So I hope that this mini series has clarified a lot of things around runner's knees for you. You should have all of the tools that you need now to help you understand your injury and move forward. Of course, always seek a healthcare professional to suit you, but I really hope that you've gained something from this video, and definitely consider using a lever in your rehab program.